Emma. I'll be doing my head-to-toe assessment. I would start by checking my patient assignment. I would set up my worksheet using patient profile. I would get report from the primary nurse. I would show my instructor my worksheet prep, and then I would get started.
Come in.
Hi, my name is Emma. I'm a nursing student at Lake Superior College. Can I get your full name and date of birth, please?
Bryce Carlin, 4/13/97.
All right, perfect. So today we're going to be doing a head-to-toe assessment on you, just kind of going over your lungs and your heart and your pulses and all that fun stuff. Are you having any pain right now?
A little bit, yeah.
Where about?
My shoulder.
Your shoulder?
Mm-hmm.
What would you rate it at on a scale of 0 to 10? 0 being nothing?
Probably
a
2.
Okay. Sounds good. So the normal vital sign ranges in adults are temp is 36.5 to 37 degrees Celsius, or 97.7 to 98.6 Fahrenheit. Pulse is 60 to 100 beats a minute. Respirations are 12 to 20 beats a minute. Blood pressure is 90 to 120 systolic, or 60 to 80 diastolic. And oxygen saturation is greater than or equal to 93%. So next I'm going to be looking at your lungs, and we always start in the back. Can you take a big breath in for me and out through your mouth? So he's symmetrical on both sides. His spinous process is straight. We'll listen to the different parts of the lungs. So every time I place the stethoscope on your back, just take a breath in through your mouth and out through your mouth. All lung sounds are clear bilaterally. And then we will do on your sides here, if you could lift your arm for me. Okay, and then the other side. You don't need to turn, I got it. All right, those are both equal. So next we'll be looking at the front of your chest. Can you take another big deep breath in and out for me? The chest rises and falls equally. There's no pulsations, and he has a standard 1:2 ratio chest shape. So now we'll listen, making sure we get the apex of your lungs up above your clavicles. Go ahead and take a breath. All right, it's all equal bilaterally. No crackles or anything. Are you having any shortness of breath at all?
Mm-hmm.
No? All right, good. All right, so next we'll be listening to your heart. Again, I don't see any pulsations. Everything looks symmetrical. So we will start by listening in your second intercostal space.
For the aortic.
Okay. And then the second one over here is your pulmonic. And then Erb's point. Okay. The fourth intercostal is your tricuspid valve. And then down here here in your midclavicular line. Is the apical, and I would listen for 1 full minute. And then I would also listen with my bell. Aortic, pulmonic, Erb's point, tricuspid, and your mitral with the apical. All right, it all sounds good. It's regular, strong. Right, so next we'll be looking at your abdomen. So if you could lay flat for me, please. All right. How is your appetite?
Really good.
Good. All right. Do you need any help going to the bathroom before we start?
Not yet.
Okay. Do you have any trouble urinating?
No.
Any pain or anything with it?
Not really.
No. When was your last bowel movement?
Earlier this morning.
Good. All right. So if you could just keep your hands at your sides. I will inspect your stomach. It is symmetrical. There are the contour is good, the shape is good. So then I will listen to your 4 quadrants. Listening for bowel sounds, which could take up to 15 minutes. But I hear bowel sounds in all 4 quadrants, which is good. So next I'm going to just kind of feel your stomach. I'll start light and then it'll get a little bit deeper. So if it hurts at all, just let me know. Okay. All right, so that was the light one. Did it hurt anywhere?
No, not really.
No. All right, so we're gonna go a little deeper. Let me know if it hurts. Okay, everything felt good. I didn't feel any abnormalities. I would also record your intake and output right now, if you had any. All right, so next I'm just gonna check over your skin, check your pulses, check for edema. So if I could see your wrists, please. Your radial pulses are equal, amplitude of 2+. If I could see your nail beds. All right, you have a good capillary refill, nice and quick. And then if you want to put your arms down, your skin looks good. There's no sign of bruising or breakdown. So next I'm gonna go to your feet. And I'm gonna check your dorsal pulses. So it's between the big and second toe, up about halfway. Okay, and they are equal and 2+. Now I'm going to check for edema, so I'm just going to squeeze your feet and your legs a little bit. That one is good. There's no edema. Got a little bit of a nick right there. No edema there either. And then I'm just going to check your capillary refill on your toes. Your feet are a little cold, so it's a little slow, but they're still refilling in less than 3 seconds. Then I'll wash my hands since I touched your feet. Okay. your skin temperature. I'm just going to feel your temp with my wrist here. Your skin temperature is normal, which is good. You don't feel cold or too hot. Okay, so now I would check to see if you have any tubing, like feeding tubes or catheters, which you do not. If you did, I would record the amount, the color, the characteristics, odor, and I'd record your intake and output. And then for your neuro check, can you tell me your name again?
Bryce Carlin.
And do you know about what time it is?
It's about 8:16 p.m.
Okay. And can you tell me where you are right now?
I'm in the clinic.
Okay. And why are you here?
Just a checkup.
Okay. Then I'm going to check your pupils for constriction. So if you just look right at me. Good.
It's really bright.
Good. Sorry. So your pupils constrict equally, which is good. And then I'm just going to check your grasp. So if you'll squeeze my hands. Good. Nice and strong, equal bilaterally. And I think we're done with your assessment. We're all good to go.
Yeah, thank you.
Thank you.